placed. Another expensive taxpayer program is the cost of prescription drugs under Medicare Part D. Joining us to discuss is OpenTheBook.com's public policy editor, Rachel O'Brien. Good morning to you.
Good morning, Jan.
You know, when you look at the amount it's costing taxpayers for prescriptions under Medicare Part D, just the top 1,000 prescribing doctors account for billions of dollars. This is ridiculous.
Yeah. So we looked through those top 1,000 providers, and we saw that the prescriptions they wrote in 2023 cost $11 billion. That's more than the $9 billion that was saved by the July rescissions package. So just to give you an idea of just how much this program costs, the top prescribers in 2023, those are the most recent numbers we have. The top 10 providers were all responsible for $50 million worth of prescriptions each that year. The figures were a little lower in 22 and 21, but 23, they just they shot right up. And it was still tens of millions of dollars worth of drugs each in those other years. So, even when you add up over the 3 years, one prescriber reached $244 million. That's almost $250 million in billing to Medicare.
How many patients would you have to be prescribing tens of millions of dollars of Medicare prescriptions? That right there could be a story in and of itself. That's very it's high. It's a lot. Are these providers though accused of doing something improper?
So no, they're not. And we're not implying that the providers are engaging in anything other than lawful conduct. It does raise the question of how could they possibly see this many patients and write this many prescriptions. But it points to a larger issue with mandatory spending, right? We're talking about healthcare right now that the Democrats are, using to keep the government shut down, and healthcare spending in the United States is grossly inefficient and wasteful. We see that every year when we look at improper payments. The Centers for Medicare and Medicaid Services, every year, they are the worst among federal agencies. They spent $87 billion in improper payments last year. And that doesn't even count fraud. Those are mistakes. In June, the DOGE charged 324 people with defrauding Medicare for almost $15 billion. And unfortunately, a lot more of that came from.
Yeah, and this is just one part of an inefficient and wasteful health insurance program that spends over $1 trillion.
Exactly. Yeah. So Medicare provides health insurance for about 68 million people. And it accounted for just over half of mandatory spending, one single program. So when there's a problem in this one program, it really adds up to billions of dollars. And we looked at just this one aspect of it, right? The Medicare Part D prescription that providers are writing these prescriptions and they're getting reimbursed. It's a massive, massive flow of taxpayer dollars through the safety net. So, just given the political rhetoric around the shutdown that has focused on healthcare, this is a good time to remind taxpayers just how much is billed to just one single part of Medicare.
Yeah, and hold the line, too. OpenTheBooks.com's public policy editor, Rachel O'Brien. Thank you for joining us.
Thanks for having me.